I think as pathologists we're being asked more and more to make assessments of specimens with respect to providing prognostic and predictive biomarkers. One example of this is PD-L1 scoring. So this is something that we've been doing for the last few years. It is not always possible to give a completely accurate or reproducible score of PD-L1, particularly if you're dealing with larger specimens. Those are the sort of settings within which AI may be of assistance to the pathologist to arrive at a clinically meaningful and reproducible value. So we've done a study looking at PD-L1 expression and trying to enumerate that by AI assistance, and that seems to work quite well. These are, I'm sure, algorithms which are going to be employed in the near future. Perhaps not ours, but other commercially available ones. But I think we can do more. So I think just looking at the hematoxylin and eosine stained slides of tumours, which is really our workhorse. So it's very simple and very cheap stain, which can be done all across the globe. I think there's a lot of information in there just from the morphology alone, which can be leveraged by AI. So that's something that I've been focusing on recently, particularly looking at just predicting prognosis of adenocarcinoma patients in the lung by using that type of algorithm. And in fact, the algorithm that we developed and have published about is better at predicting prognosis than we are as pathologists by just scoring these tumours according to their ISLC score or patterns. And we're also using these sort of algorithms for tumour types which we find difficult to classify as pathologists because there is overlap in terms of morphology or because we're missing some parameters perhaps in our classification system at the moment. So we're applying that also to neuroendocrine tumours of the lung, but also, for instance, to thymomas, another intrathoracic tumour, to perhaps come up with an algorithm which can faithfully predict the classification of these tumours.